Lisberger. I'm the Director of Gender and Women's Studies here. I'm honored and really thrilled that Nika Leiba is here with us today, up from Washington, D.C., to carry on the tradition of the Schweers Annual Lecture on Women and Health. This annual lecture, which was established in 1981, was funded by Dr. Patricia M. Farnes in honor of Freddie, a very gifted young woman who died of leukemia at the age of 16. 4 years later, Patricia Farnes, the pathologist who took care of Freddie, herself died of cancer. This annual lecture honors the courage and dedication of Freddie, Patricia Farnes, and Jeannie Wild, who was the prime mover in establishing supportive emotional health services for patients and families at Hasbro Children's Hospital. I'm honored that Jeannie is here with us today. Thank you, Jeannie. I also want to thank other sponsors and supporters, the Colleges of Pharmacy, Nursing, and the Environment and Life Sciences, and the Pre-Health Professions Advising Program. I want to thank, in addition, the Gender and Women's Studies admin, Tina Ignaski, and our work study student, Africa Smith, for the PR work that they've done so arduously. I want to thank Tim Tierney for being here to make a video of this. Thank you, Tim. And I also want to thank the Gender and Women's Studies faculty for their support. Last, but certainly not least, I want to thank all the Gender and Women's Studies students who continue to ask and demand answers about justice, equality, and sustainability. We are delighted to have Nika here with us to share in our efforts. Thank you. Nika Leiba is Deputy Director of Research and one of the environmental working groups leading researchers on toxic chemicals in consumer products. She leads the organization's work on chemicals in cosmetics and personal care products and is responsible for overseeing the routine maintenance of the organization's flagship consumer database, Skin Deep. This database houses safety and rating information for more than 72,000 products. Nika has appeared on CNN and a wide range of television outlets talking about toxic chemicals found in popular makeup products and sunscreens, soap, toothpaste, mouthwash, shaving cream, the list goes on. She has been quoted in Time, Yahoo News, and the Huffington Post, and O Magazine named her a green game changer for her work. Since joining EWG in 2006, Nika has authored several groundbreaking reports, including EWG's Dirty Dozen list of endocrine disruptors, EWG's Guide to Bug Repellents, and EWG's Guide to Sunscreens. She has several degrees, including a Master's of Philosophy in Zoology from the University of the West Indies and a Master of Public Health from Johns Hopkins University. Please join me in welcoming Nika Leiba here today.
Thank you so much, Judy. I think I'm so excited to be here to give this lecture. I'm honored, especially knowing the past and the history of this lecture. I'm really excited to give it on cosmetics and your health, potential impacts for men and women. EWG, the organization I work for, is a nonprofit public health and advocacy organization based in Washington, D.C., and we advocate for stronger protection for environment and public and human health from toxic chemical exposures. That's a mouthful. We have worked on chemicals in air, food, and water, and as you'll see from this lecture, we've worked extensively on chemicals in your personal care products. A point to note, the law that governs personal care products is called, in part, the cosmetics law. So I will use that term interchangeably. Cosmetics does not just mean your lip gloss and your lipstick. It also means anything you rub on your skin. So moisturizer, toothpaste. So keep that in mind. Again, I will use the term interchangeably. So I'm not sure how many of you ever thought about this question. How many personal care products do you use each day? It's not something that I particularly thought about before I started working on it, but I actually counted the other day and it was higher than I thought. If you think about your routine, it probably starts with bar soap, maybe some moisturizer, deodorant, toothpaste perhaps, well, hopefully. But when EWG did a survey back in, I think it was about 5 years ago, we surveyed 2,300 people, and we found that women on average use 12 personal care products each day, while men, many who don't think they use any at all, in fact use 6 personal care products on average each day. Through this exposure, women are exposed to about 168 unique chemicals, while men are exposed to an average of 85 unique chemicals just through the exposure from these products. Now, many people use these products and slather them on their skins without giving much thought to the health or safety of the ingredients in personal care products. Our work at EWG, however, has shown us that that's not the right way to go, because many of these ingredients, the vast majority in fact, have not been publicly assessed for safety, and some of the ones that have been assessed have been associated with negative health impacts. That's why EWG developed our Skin Deep database about 11 years ago now. We developed it to help consumers find products that are safer, products that are better for themselves and their families. Skin Deep, like Jody mentioned, is a hazard database that houses more than 70,000 personal care products and 9,000 ingredients. We have health and safety data on each of these ingredients, and our EWG scientists, including myself, go through the ingredients of each product and cross-reference each ingredient against 60 toxicity and regulatory databases. With that information, we're able to look for all the hazards associated with each ingredient, come up with a hazard score for each ingredient, and ultimately a hazard score for each product. The hazard scores in Skin Deep range from 0 to 10, 0 being the best score possible, and 10 being run away from this product as fast as possible, being the worst, obviously. A few of the references that we use in Skin Deep to come up with these hazard scores are the International Agency for Research on Cancer, which is IARC, the National Toxicology Program, we use a lot of their data as well, Environmental Protection Agency, Centers for Disease Control and Prevention, and the National Library of Medicine. We also use international regulatory sources, such as the EU's COSING database, Japanese Ministry of Health, and Environment Canada. With the international sources that we use, we are able to tell if ingredients are banned or restricted in other countries, yet are used freely and fully in US products. When we started the database, we found that 34% of the products had at least one ingredient that was linked to cancer. 45% had at least one ingredient linked to reproductive and developmental toxicity. And 60% had at least one ingredient linked to endocrine disruption. So we know that we're being exposed to these ingredients, some of them associated with hazards. But the next question that you may ask is, does that matter? Are they getting into our bodies? EWG has done a number of biomonitoring studies over the years, and I'm not sure how many of you know what biomonitoring studies are, but basically you look at markers in the body, whether it's through blood, urine, or breast milk, and you isolate chemicals to see if the chemical or the chemical metabolite has gotten into the human. So we did a biomonitoring study in 2008 where we tested 20 teenage girls for 25 cosmetics chemicals, and they were common cosmetics chemicals. And we chose teenage girls for 2 reasons. The first is that teenagers are going through a period of adolescence, which is one of the critical windows of development. And I'll talk a little bit more about that in a second. But also, teenage girls, not surprisingly, use more personal care products on average than any other demographic. Whereas women on average use 12 and men on average use 6, like I said, teenage girls use a whopping 17 products a day on average. And so their exposures obviously are greater than exposures to the rest of the demographics. So we tested for 25 chemicals and we found 16. 7 of them were plasticizers, including phthalates. 6 of them were preservatives, including parabens. 2 of them were fragrance chemicals, including synthetic musk. And 1 was an antimicrobial known as Triclosan. However, all 16 of these chemicals had one thing in common. They were all endocrine disruptors. Endocrine disruptors are chemicals that are capable of interfering with our hormone system and hormone signaling. And this was especially concerning to us because teenagers, as I said, going through this critical window of development, going through adolescence where a lot is happening in their bodies. They're going through rapid growth and development. Their reproductive systems are maturing. There's changes in their brain, blood, and bones. And also their immune system is developing and maturing as well. All of these changes are being driven by hormones. So teenagers are therefore extremely sensitive to these chemicals that are capable of interfering with their hormones. The next lead-in question would be, are these causing health effects? We know we're being exposed. We know they're in our bodies. But again, does that matter? Are they causing health effects? And that's the money question, isn't it? Environmental chemicals and environmental contaminants in general, one of the hardest things to do is pinpoint cause and effect. The end products or the health effects we look at can be caused by so many factors. And also the latency period, the period between exposure and the health outcome can be so long. It can be decades, sometimes it even crosses generations. I don't know how many of you have ever heard of DES. DES is one of those that the impact crosses generations before it's seen. So this makes it exceedingly difficult for us to pinpoint cause and effect with these contaminants. Yet we remain extremely concerned because laboratory studies, lab tests, animal tests, show us that these chemicals are causing an effect in the lab. And then when we look at a human population level, we're seeing health trends, disturbing health trends, such as decreasing fertility, increasing rates of prostate and breast cancer, increasing diabetes, increasing obesity, that's just to name a few. And these are some of the same health impacts that we're seeing in the lab when we test these chemicals on animals. Another health impact we're seeing is early onset of puberty. This, if you talk to any doctor who deals with children, they'll tell you that this is definitely a trend. It basically means that our children are reaching biological adulthood at a younger age. One study reported that in 1920, the age of onset of puberty was more than 14 and a half years. By 2010, the age of onset of puberty had dropped to 10 years old. Scientists are certain to say, I mean, there's no doubt that they don't have a definitive cause of why this is happening, but they do suspect that environmental chemicals are probably the cause. And they suspect that endocrine disruption plays a particular role in this. And again, these are just the sort of trends that we're seeing in public health that makes us know that something is going on in our environment. It's not just genes alone, but things are changing too rapidly that to not think that our environment and environmental chemicals are involved. Another trend is cancer, like I mentioned before, and the Physicians for Social Responsibility say that environmental factors, including exposures to environmental carcinogens, are estimated to be responsible for up to 80% of cancer diagnosis and death in the US. That number surprised me. up to 80% of cancers diagnosed in the US could be attributable to environmental contaminants. The group goes on to list a couple of sources of these environmental carcinogens, and pesticides is among them. That's not shocking. Industrial chemicals is among it. That's not shocking. But they specifically cite consumer products and cosmetics as one of the sources of these environmental carcinogens. As somebody that has worked on this issue for more than 8 years, again, that's not surprising to me, because I know that known human carcinogens are in our personal care products. Formaldehyde, for example. I'm not sure, and I don't want anyone to raise their hands yet, but if you've ever done a keratin hair straightening treatment, all right, well, that has a high percentage of formaldehyde. For those that have done it, they know that you, depending on the product you use, you leave it on your scalp for up to 3 days. A known human carcinogen. There are also chemicals like hydroquinone, and that's in skin lightening treatments. That's a suspected carcinogen. It has shown carcinogenic activity in animal tests. And a number of our personal care products are also contaminated with 1,4-dioxane, which is a probable human carcinogen. So again, the fact that the Physicians for Social Responsibility, this group of doctors, has said that cosmetics is among one of the sources of environmental carcinogens that contribute to up to 80% of the cancers in the US, not surprising to me, but very, very unfortunate. In 2010, the President's Cancer Panel came out finally with a statement on environmental contaminants and said that the true burden of environmentally induced cancer has been grossly underestimated. They went on to say pointedly that Americans are facing grievous harm from the or understudied and largely unregulated chemicals used by millions in their daily lives. So how did we get here? How did we get to a point where known human carcinogens are in our products? Well, we got here because the agency that oversees personal care products and cosmetics, the FDA, basically has no authority. When it comes to food and drugs, they have a lot of authority. But when it comes to cosmetics, it's virtually nil. The Federal Food, Drug, and Cosmetics Act was passed in 1938. And at that time, more than 340 pages were dedicated to food and drug safety. Yet only 1.5 pages was dedicated to cosmetic safety. It's interesting how that 1.5 pages got in there too. Back in the 1930s, women were using products and having injuries. One case that got a lot of attention, it garnered a lot of press, I think there was even a lawsuit, was a case against Lash Lure, which is eyebrow and eyelash dye. And a woman was using it, and she developed a staph infection in the eyebrow, which spread to her eyes and resulted in total blindness. So they added 1.5 pages to the Federal Food, Drug, and Cosmetics Act on cosmetic safety. Since 1938, how many times do you think we've updated this law? None. We have not updated this law at all since 1938. Has anything changed since 1938? No, nothing? Yeah, quite a lot has changed, yet this law has not changed. So we're still at 340 plus pages on food and drug safety, which is great. Well, it could be a little bit more, but that's a different lecture. And only 1.5 pages on cosmetic safety. Under this law, the FDA can't require pre-market testing of products. They have no review authority of ingredients or products. They have no approval authority. And this is the kicker. The FDA cannot demand that a company recall a product, even if the product has been shown to cause harm. So this lash lower product, if that was being used today, it has led to blindness. There were other cases of injury as well. The FDA can suggest that the company issue a recall. They can ask nicely, but they can't mandate that the companies issue a recall. So what does this mean for us? Who is running the show? Basically, it's the cosmetics companies. They're deciding what's safe for us. Since the FDA does no systematic review of ingredient safety, they have authorized the cosmetics company to do those reviews through an industry panel called the Cosmetics Ingredient Review Panel, the CIR. The CIR was established in 1976, and since 1976, the CIR has rejected 11 ingredients as unsafe in cosmetics. As a contrast, the EU has banned more than 1,000 ingredients, yet the CIR has a paltry 11. Since 1976, the CIR also has still not reviewed the vast majority of ingredients that we use daily. That was all bad news, but the good news is that there's hope. People are being educated. People are figuring out these atrocities, and people are demanding change, and the market is changing. When you go into a store now and you look at products, you often see labels touting that this product is free of some ingredient of concern or another. I'm not sure how many of you have ever seen this, but free of parabens, free of phthalates, SLS, SLES free, all of these claims on these products. It's becoming widespread. But more importantly, some large companies have made pledges to reduce or completely remove or phase out a lot of the ingredients of concern. In 2012, Johnson & Johnson pledged to remove Triclosan, which I mentioned as an endocrine disruptor, phthalates, some of the phthalates, again, endocrine disruptors, parabens, endocrine disruptors, formaldehyde, carcinogen, 1,4-dioxane, carcinogen. That was a great move on the part of Johnson & Johnson. And in fact, they have been phasing it out. The next year, Procter & Gamble, the makers of CoverGirl and Old Spice, pledged to also remove one of the phthalates. And then just this past year, Kimberly-Clark, the makers of Cottonelle and Scott Tissues, said that they were phasing out methyl isothiazolinone, one of the hardest chemicals to say out loud, out of their wipes. And they're doing this because methyl isothiazolinone causes allergic reactions. The scientists have known this for a long time. However, moms started to really complain and send in pictures of their kids with these burns and allergic reactions all over their face and skin. So now they're removing methyl isothiazolinone from their products. Since there has been movement on the market, we've also seen movement reflected in Skin Deep. As I mentioned earlier, 34% of the products had at least one ingredient associated with cancer when we built Skin Deep more than 10 years ago. That number has fallen to 19. 45% of the products in Skin Deep had at least one ingredient associated with reproductive and developmental harm. That has fallen to 39%. And 60% had at least one endocrine disruptor, or at least one ingredient associated with endocrine disruption in their products. And that has fallen to 35%. We've also seen movement on Capitol Hill. In 2013, Representative Jan Schakowsky introduced the Safe Cosmetics Act of 2013. Unfortunately, the bill didn't pass through Congress. But had it passed through, it would have required that products be safe for children and others who are sensitive. And by this I mean it would be safe for all vulnerable populations. Now, if a product or an ingredient is safe for all vulnerable populations, it means that it would be safe for all of us. So any bill that is enacted, we would hope would be written so that the products would be safe for vulnerable populations. It would require labeling of all ingredients. And while cosmetics do label most of their ingredients, and they're required to label most of their ingredients, there are a few ingredients that fall through loopholes. Fragrance, for example. I mean, I know everybody here has seen fragrance on their products if they're looked at the label at all. Fragrance can encompass more than 3,000 ingredients. And it's virtually impossible for the consumer to know what those ingredients are. So if you're particularly allergic to something, or if you're trying to avoid something, it's impossible if there's fragrance in the product. This bill would have required even fragrance to be fully labeled. And most importantly, would have given the FDA the authority it needed to ensure that products are safe. And one of those authorities would be recall authority. As I said, this act was not passed through Congress, but we are hopeful that another bill that addresses similar concerns will be passed soon. So what can you do? What can you do to avoid all of these harmful ingredients? What can you do to ensure that the products that you slather on your skin daily don't have carcinogens in them or endocrine disruptors? The main thing to do is get to know your ingredient list. Turn that product upside down, flip it over, look at the ingredients, and if you see a product with an ingredient that you're concerned about, don't buy it. So we had put a number of these cards up at the back, but I have more for those who didn't get one. But I'm going to go through a few of the ingredients on the wallet guide, just so that you can get familiar with them. Triclosan. Triclosan, I mentioned a couple of times, it's one of the endocrine disruptors. It's frequently found in hand soap, liquid hand soap in particular. Triclosan has been shown to disrupt thyroid functioning, and it affects some of the sex hormones as well. The FDA, interestingly, well, I should say that Triclosan is an antimicrobial, which I think I said, but it is added to products, hopefully to kill bacteria. That's the aim, that's why they add it to products. But the FDA recently came out and said that, you know what, you don't need Triclosan to kill bacteria. Regular old soap and water will do. So why are we adding Triclosan to products if we don't need it? If even the FDA is saying we don't need it, why is it continually added? I mean, that's a great question. Triclosan has also been shown to be toxic to aquatic organisms, and because it's used so much, scientists are concerned that Triclosan is adding to antimicrobial resistance. So the next chemical that we're going to look at is dibutyl phthalate. And this is just one of the many in the phthalates class. Phthalates are potent endocrine disruptors. Dibutyl phthalate being one of the most potent. They're ubiquitous. Phthalates aren't just in personal care products, but they're part of PVC plastic. So most of the things that are made out of plastic, or PVC plastic in fact, will have phthalates in them. Phthalates are especially of concern to baby boys because phthalates have been associated with cryptorchidism. Does anybody here know what cryptorchidism is? Cryptorchidism is undescended testicles. So this chemical has been shown to cause cryptorchidism in baby boys, and it also affects sperm motility. So men should be careful about their products as well. The other ingredient is retinol palmitate. Now, retinol palmitate is an anti-aging chemical or ingredient, and in night creams it's fine, but manufacturers have started to add retinol palmitate regularly to sunscreens as an anti-aging ingredient. The problem is that tests commissioned by the government found that on sun-exposed skin, retinol palmitate increases skin tumors and lesions. So on No sun exposure, that's fine, but on sun-exposed skin, government tests found that it can increase skin tumors and lesions. Fragrance, I went through a little bit, more than 3,000 stock ingredients that the fragrance industry can use. It's pretty difficult, if not impossible, for you to tell what ingredients are there. Phthalates tend to be in fragrance, which is an endocrine disruptor, synthetic musks as well, as I had mentioned in our teen girls study. So we always suggest that consumers be wary of products with fragrance, especially if you have allergies. Fragrance also tends to have a lot of allergens. And then finally on this sheet, DMDM hydantoin. DMDM hydantoin, and actually the two ureas on the DMDM, are a group of preservatives that are formaldehyde releasers. So companies add them to their products, and as the product sits on the shelf, this ingredient or this group of ingredients releases formaldehyde into the product to preserve it. A very good preserver, also a known human carcinogen. The other thing that you can do would be to use Skin Deep's, use EWG's Skin Deep database. As I mentioned before, Skin Deep has more than 70,000 products in there now. We're constantly updating, and the products are scored based on the hazards of the ingredients. Skin Deep has about 5 million page views per month, so it's widely used, and we are contacted by companies, industry regularly, as well as consumers regularly about this database. We also developed an app for the Skin Deep database, actually. There are about 500,000 users of this app now, and the app is great at point of sale because it has a barcode scanner. So you can scan the product at point of sale to figure out what the score is. It's important for us all to vote with our wallets. I had mentioned earlier that all these companies were making changes, and I can guarantee you, although the companies aren't publicly saying it, a lot of them have told us that they're making these changes because consumers will not buy their products when these ingredients are present. So it's really important for us to feel empowered and vote with our wallets. Now I have a little section that's a true and false section, and I'm hoping that I can get some participation if we're not too shy. I'll also know how many of you have been really listening, because this is a little bit of a recap, FYI. So, true or false? If it's on store shelves, it must be safe. Does anybody think it's true? Yay, good job. No, I mean, my lecture for the last half an hour, 35 minutes should have told us that if it's on store shelves, there's no guarantee that it's safe, or laws are broken. They don't protect us from hazardous chemicals. If it's on store shelves, there's no guarantee that it's safe. As a consumer, you have to take it into your own hands, educate yourself, and buy. There are safe products on the market, that should be said. And I want everybody in here to hear that. There are products that are safe. I have on lip gloss now. It's a safe one. You know, it's not that everything is associated with harm, but you have to do your homework. So the answer is false. The government prohibits the use of dangerous chemicals. Sure enough, the government has no authority to prohibit the use of dangerous chemicals. So again, that is false. Cosmetics are applied to the skin, so the ingredients don't enter our bodies. It's not a problem. False. Does anybody think that's true? That, in fact, is false. And that's not just based on EWG testing. The CDC also routinely does biomonitoring studies, and they found that, for example, Triclosan has been found in 75% of us. The parabens and the phthalates, ubiquitous in more than 95% of the Americans they've tested. So this isn't a new phenomenon, it's not an EWG thing. This is a well-known thing. These chemicals are getting into our bodies. What effect that's having, that part is a little unknown because each person is different and the effect will depend on a lot of factors, but they are getting into our bodies. So I didn't really go over this one as much, but products with claims such as natural or hyperallergenic are always safer options. That one is true. I mean, that answer is right. It is in fact false. And this is because the FDA has no definition, no legal definition of natural. What natural means to company X could be completely different than what natural means to company Y. There is no definition. And in fact, the FDA does not regulate claims at all. So when you're buying products, it's important that you don't rely on claims. Again, become familiar with the ingredients themselves. Consumers can read labels to avoid all hazardous ingredients.
Oh.
I'm hearing some truths in the audience. This is a tricky one, so if you think it's true or false, I mean, whatever you think the answer is, it's fine. For the most part, cosmetics are labeled very well when it comes to ingredients. I'm not sure how many of you have ever looked at the back of a cleaning product label. There's likely no ingredients at all. Cleaners don't have to put anything on their labels. Some of them do, and they're just like, preservative. What does that mean? What is preservative? Cosmetics does have to be labeled a little bit more than that, but there are a few loopholes like fragrance, which is why the answer to this is false. And finally, you can make a difference. True or false?
True.
That's a resounding. I need it. True or false?
True.
That is the truest thing I hope you take away from this lecture today. And if you have any questions, I'd be happy to take them.
Good. Go ahead.
In the pamphlet, it says to avoid SPFs over 50, and I was just wondering why.
The pamphlet says to avoid sunscreens with SPFs over 50, and she'd like to know why. The reason that we say that at UWG is because we think that SPFs over 50 are misleading, especially the really high SPFs, the ones that go up to 100, etc. They don't offer much more protection than SPFs under 50, yet people think that they have put on an iron shield and they're completely protected from the sun. The FDA is also considering capping SPFs at 50 because of this misleading notion. So we at UWG also suggest that 50 is the cap.
I was just wondering if there was a reason to why the FDA doesn't have more authority.
That's a great question. Right, why doesn't the FDA have more authority? I'm not sure. There's not a lot of movement on Capitol Hill. There hasn't been for a little bit. But why they weren't given more authority before? I would venture a guess. I would venture it's because consumers weren't making noise about it. Everybody was talking about food and drugs, and nobody was talking about cosmetics. Despite the fact that we use cosmetics probably more than we use some drugs, probably not as much as others, but definitely as a little bit on the same par as food, but it wasn't seen as a concern. With food and drugs, you'll see the effects almost immediately. You'll see if you're food poisoning, for example, you'll see that in a matter of hours. You're not going to see effects from cosmetics as readily, for the most part. There's not a lot of acute reactions with cosmetics.
Has EWG given any thought to including or addressing the use of nanites in cosmetic products?
Has EWG thought about the use of nanoparticles? in cosmetics. Yes, we look at nanoparticles a lot. Particularly right now, we look at their use in sunscreens. Whereas in other products, we don't advocate for the use of nanoparticles because we don't know what happens once they get into the body. We know that there's a potential for harm, but a lot more studies need to happen to know exactly what the cause is. But with sunscreens, because we don't have a lot of options, some of the more beneficial sunscreen active ingredients are nano. And so we do say that on unbroken skin, in lotion form, so there's no possibility for it to be inhaled, then nano is a viable option. But otherwise, we're not pro-nano.
I had two questions. One, you'd mentioned to me something about umbilical cords in newborns that I don't think you talked about.
No, I didn't, unfortunately. EWG did a study, I want to say more than 10 years ago now, where we looked at cord blood of newborns, babies that were just born. They hadn't had any water, no food, hadn't had much time to breathe air. And we tested their umbilical cord for a multitude of chemicals. And we found more than 300 chemicals in the umbilical cord blood, which drove us to do so much more work because we realized that babies are being born pre-polluted. They haven't lived, they haven't done anything, and they're born pre-polluted.
I actually have a whole lot of questions, as you can imagine. But another question. So a lot of people might say that EWG is a research organization. You're not doctors, that you do soft science instead of hard science. Could you give a response to that?
Sure. A lot of people say a lot of things. My team includes, we used to have a medical doctor, she recently left. We have 3 toxicologists, 1 chemist, 1 cancer specialist, all PhD scientists. If I was to tell any of those PhD scientists they're doing soft science, they would have my neck. But again, we will hear that sort of thing. At EWG, we're very, very confident about the work that we do, about the science that we put out. We wouldn't put out something unless we were clear about it. And we're not saying that using your mascara is going to cause cancer. What we're saying is that consumers need to know that there's a possibility that there's harm associated with these products and these ingredients. We're educating the public about potential harm, and so it is what it is.
Is anyone looking at how these chemicals might interact? You've got both these hazardous chemicals and potentially not hazardous chemicals that when they interact with other chemicals may produce something hazardous.
Right, and that's a great question. Because we know that, how do these chemicals interact? We don't live in a vacuum. We are not being exposed to one chemical at a time. Aggregate exposure, cumulative exposure are all things that happen. But most of the research that's being done now only looks at single exposure. So our toxicology, currently, how toxicology is done, it's single exposure. But we are pushing for cumulative and aggregate exposure studies as well. There was a question in the back. What moisturizer do I use? You know,
Of all of the things that I use, I've got to have my moisturizer. So I'm wondering what.
Moisturizer is important. Unfortunately, as I am here on behalf of EWG, I can't name brands. We're brand blind. But there are moisturizers out there that are devoid of ingredients that I'm concerned about. It does take some time. A moisturizer that works for me may not obviously work for anybody else. It depends on the composition, your genes, and all of that. So I would encourage you to check out Skin Deep and look for a few moisturizers, but there are safer moisturizers.
I have another question. I haven't dug into the database with any detail, but do you occasionally also address the products from other countries that are being brought into the United States?
That's a great question. We get product submissions from companies, maybe 5 companies a day. Companies are always trying to get into Skin Deep. They want to advertise that they are making safer products. We do get some products, or we do get requests from companies that make products that are not sold in the US. However, we only accept products. It can be an international company, but they would have to sell their products in the US. Because on a large scale, what we're trying to show here is a lack of regulation in the US. Also, when it comes to sunscreens, for example, the rules are so much different in Europe. And the allowable ingredients are way different in Europe, that it wouldn't be fair to use our algorithm on their products. Julie?
Can you talk just a little bit about your own career path for students who might be thinking about going from wherever they are to environmental studies or public health? Can you just talk a little bit about your path?
Sure. So I did my undergrad and master's degree in zoology in Jamaica. And it was a purely ecological track. It was just pure ecology. However, my best friend and I at the time, still my best friend actually, were also interested in health. We were grappling with med school for a while, but both of us had such a passion for environment and environmental issues. And so we were trying to find a way to blend the two, blend ecology and environment with health. And we found a program at Hopkins that did environmental health. And so we ultimately did that, went to Maryland in 2005. After I left Hopkins, there was an opening at EWG to build this database. When I started, they only had about 20,000 products or less. And it was my job to build the database. Then, because I have an aquatic sciences background, they decided that anything water would be mine as well. So I also do tap water quality and bottled water quality. And over the years, I've moved up the ranks from analyst to, what was my first title? Anyway, it was lower than what it is now. And ultimately, I am now the Deputy Director of Research, so I oversee all of the projects that come out of UWG.
So you mentioned a lot of companies are taking their own initiative to take these things out of their products to meet the demand. Do you think the market's going to continue that way and eventually kind of fix itself, or do you think it should be up to the government to step in and institute something?
Also, do I think that the shift in the market will continue, or do I think it's ultimately up to the government to fix things? Ultimately, I think it's up to the government, because there will always be companies that don't. And we want consumers to be able to choose from any product on the shelves and be ensured that a known human carcinogen is not in them. And we don't think that that will necessarily happen without some involvement from the government, because there will always be laggards. But there is continual movement, and I can tell you that even though there are more companies, Revlon recently came out and said they were taking out some ingredients out of their products as well. And so we think there will be continual movement on that front. There are also smaller companies that are getting larger. I mean, they were small when they started, but they're getting larger. And so there's a movement of green, quote unquote green, I don't really like that term, but the green companies are moving in as well.
Anybody else have a question? I know that Nika will be here afterwards if you have a question that you want to come up and ask her about. Thank you so much for a very useful